Hello, hello, hello. Okay, so I welcome you all to the. Can you all first of all see me, hear me well, and see my screen? First, let's do a little check. Hello, Dr. SKC. Hello, Dr. M. Hello, Dr. Jitendra. Okay, very well, very well. So I welcome you all to this really something that something I because I'm also very socially active, and you might have seen me in some other some social media platforms or somewhere. So like I get like a lot of doubts, a lot of questions regarding what we are going to discuss in this webinar. And that is really something why it makes this webinar to be really important. Okay, because I think all of you are medical graduates, right? Some of you might even have done their post-graduation. So all of you are doctors, right? So when it comes to the actual exams, okay, when it comes to the exams, it's actually the thing that we just have to guide you. We just have to put you in the right direction, right? But that is not something that is not known to you, right? But when it comes to the topics that we're going to discuss today, okay, that is something that is not very well known, right? And I know a lot of people who just because they knew the system, so that was the reason why they got into it really well, okay, and that too in a less amount of time with less amount of effort, right? So that is the reason why that it's very important for you to, if you want to enter the Australian healthcare system, it's very important to know the system first, right? You need to know the waters that you're going to have a dive into. I mean, you cannot just dip into the unknown waters, right? As the word say. Okay, so that's the thing. So today we are going to discuss. Okay, today is AMC and beyond. That's your road to medical career in Australia. That is the topic for today. Okay, so this is what is something that we are going to discuss today, right? Basically, okay. So here we will overview the whole system. Okay, and first of all, let me tell you one thing. When it comes to about Australian healthcare system, it's very picky, and at the same time, it's very variable as well. Okay, so when I say variable, what it mean? Okay, so if you compare it with other contemporaries and what contemporaries you might be thinking of, and also this is something that would have crossed your mind, right? So whenever you today you go and you tell your friends, you tell your family that okay, I want to move to Australia, I want to work as a doctor in Australia. So the very first natural question that will come in their heads is why Australia, right? When there is already US, there is UK, there is Gulf, okay, there's other parts of Europe, right? If you come to think about it, right? See, first of all, this is what I tell in my even in my regular lectures as well. Okay, I'll be really happy if you keep comment section open. So this is why I know I logged in my phone as well. So parallelly, I can keep checking the chat section. Okay, and anyways, this is not a lecture, guys. Okay, please relax, relax. Okay, we are here to have a chat. Okay, this is a seminar, but this is a two-way thing, right? So I want all of you guys to communicate. Okay, to put whatever you're thinking, whatever your doubts you have right into your chat box and we will talk about it. Okay. So when it comes to the other contemporary, which is US, UK, and Gulf countries, okay. So what happens over there is that the pathway over there is very streamlined. Okay. Like for example, if we talk about US, okay, it's just you need to go, you need to take MLEs, you need to take USMLE exams, you need to take step one, then step two, go for some electives, okay, then sit into the matching process, which they call as NRMP, right? And then get a seat. Okay, get into residency. Okay, the similar thing you can say with the UK as well. Okay, you need to take PLAB once, then you go over to PLAB 2, you get GMC registered. Okay, then get into a junior doctor position and preferably then get into your core training and the specialty training pathway. And the similar, I think, is to the Gulf as well. I'm not so very aware about the Gulf. Okay, but if we talk about the main contemporaries, which is US and the UK, the pathway is very streamlined. Okay, no matter whoever you are, like in UK it differs, like if you're a specialist doctor, right? Okay, first of all, tell me from our chat box, I think how many people do we have? Who amongst you are specialists who have done your post graduation, okay, in one of any of the arenas? Do we have any postgraduate doctors here? Okay, I just want to know the demographic that I'm addressing today, okay, so that I can shift my talk in that certain way, right? So I just want to know the demography that I have. If I don't have any postgraduates, then there's no point of me talking about it. Okay, so do we have any postgraduate doctors in our session today? Hello. See, if I don't get any message, then I get really anxious. That means that I'm having some internet issue or what? Hello. Any postgraduate doctors in the room today? No? Okay, thank you, Dr. Lalasa Desai. Okay. Okay. Net issues. Is there a net issue or not? I'm confused. You're a postgraduate, Dr. Oh, okay. Thank you, Dr. Desai. Dr. Mokrima. Okay, you're a postgraduate in. Oh, okay. Thank you, Dr. Bansal. Thank you for addressing that. Right. See, anyways, I'll talk about it. So, see, for the postgraduates, okay. So, I think for that, so in the UK also, see, for the US, it's same for everyone. Okay. I don't know whether it's for good or for better. Okay. But for the US, if you talk about, no matter whatever specialist doctor you have done your super specialty, anything. Okay. You still have to take USMLE step one. You still need to study anatomy, biochemistry, physiology. Okay. Which doesn't make really much sense to me. Okay. But that is how the system is in the US. Right. But for the UK, if you talk about, it is, you can get into specialty positions. So similarly, I think you will find a lot of similarities between the Australia and the US, sorry, in the UK system, right? So there is a different pathways for the international doctors, right? So one is obviously the standard pathway, which is we commonly call it as an AMC pathway. Another is a competent pathway, authority pathway, and another is a specialist pathway. Three pathways, three main pathways are there, okay, for the international doctors, right? And we will talk about it. We will talk in detail about it, okay? So these are the main three pathways. Okay, so depending on what section you're fitting into, what table you sit into, okay, depending on that, you need to go towards it. Okay, you need to choose your pathway, first of all. Okay, for most of the doctors, it is a standard pathway, which is the AMC pathway, right? And what is competent in the specialty pathway, we'll talk about it, right? And then there are some key licensing body that you should be aware of. One is obviously the AMC, which stands for Australian Medical Council, if you don't know till now, right? Another is the APRA, which is Australian Health Regulation Policy Agency, right? A practice agency, right? And another is the Medical Board of Australia. So APRA looks after your registration, right? So once you pass your exam and once you get a job, then you need to do something, which is the APRA registration. And again, there are three different types of registration, which we'll talk about, which includes your limited registration, your provisional registration, as well as your general registration. We'll talk about it. Okay, so that is that. Everything is in three pathways, three licensing body, and three exams. Okay, so the other three exams would be the AMC, which is obviously two parts, AMC MCQ and AMC Clinical. Okay, another is the IELTS, the English proficiency test. Another is the PESCI. PESCI is for the GP pathway, which again we will talk about. Okay, so let's give a general introduction, which is an overview of the Australian healthcare doctors and the demand of doctors over there, right? Okay, so just like uh, most of the countries, okay, just like because I'm from India, so just like that we have in India, okay, so we have a public system, we have the private sector, okay, and then we have the primary care over there. Okay, so primary care is something which a little bit differs, which is again in line with the UK system that you might think of, right? So public system is obviously which is all the hospitals which is covered under the Medicare, right? So Medicare is nothing but it's the health program under which all the citizens or the peer, all the ones who's got peer is insured, right? Okay, another is the private sector, right? The private sector is obviously the private hospitals as well as the private clinics. The third thing is the primary care. So primary care is actually the GP clinic, okay, and is actually the GP clinic, right? So what happens in the GP clinic is that see, for example, you're living in an XYZ area, okay? Okay, so for that, a particular GP is assigned, right? That is also again in line with the government only. So that is the primary care, right? So I'm ECFMG certified with USMLE steps. I'm AMC-1 pass eligible for competent authority pathway. If I get 1 year of experience in Australia, does it increase my odds of getting the job? Thank you. We'll talk about it, Dr. SKC. We'll talk about it, right? Okay, we will talk about it when you come to the competent authority pathway. Okay, surely we'll talk about it, right? Okay, so this is the three lines we have. Right. So just like any other country, there is always obviously the shortages of doctors in the rural and the remote areas, right? So for the people who's already in Australia, they might be knowing this thing, right? So when you talk about the rural and the remote areas, okay, there is a lot of demand over them. Okay, and in particularly, so if you're someone who's going against the standard pathway and you have to choose your stream, okay, and you're very adamant over the fact that I want to go and move to the Australia, right? So this is something that you can target for. One is obviously the GP, okay. Another is emergency medicine. There is a lot of demand over there. Emergency medicine, right? Third is the psychiatry. Okay. And the fourth is the aged care and the chronic disease management. Okay, aged care and the chronic disease management. So there is actually there is nothing but that is your geriatric medicine. Okay, so this four, okay, this four is very and see this is also something. I have LMCC, but internship from India. Would you be kind enough to let me know what is LMCC? Yeah. Okay, so these are the four streams, which is very a lot of demand in Australia. Okay. Right. So this is something that you can keep in mind. So obviously the IMG recruitment is crucial for the system stability for two reasons. Main is first is not much of the Australian youth goes into the medicine, just like it does in the South Asian countries. Okay. Right. From okay. The Canada membership. Okay. Can so that means that you have done your primary medical education from Canada, right? And but you've done your internship from India. That doesn't make sense to me. Why have you not done internship from Canada only? Why did you want to come to? Because this is Canada is competent with India, right? Okay, right. So this is the four things. Okay, so obviously the first is AMG is when we talk about the account for the 30% at least of according to the recent data by the APRA, they come from the 30% for the Australians medical workforce. Okay, see, let's do one thing. Let's do one thing. Just give me some time. Okay, everyone. Just let me discuss the pathways and about the registration. Okay. And after I've discussed that, I'm pretty sure that most of your questions would have been solved. And after that, I'll open the floor for questions. Okay. Because in this way, I might miss on some questions. Okay. And I don't want to do that. Okay. So just wait a little while. Okay. And I request you all to Dr. Rucha, Dr. iPhone, Dr. SKC. I request you all to just give me some time. Okay. And let me finish this thing. Let me finish talking about the pathways and the registration. I'm pretty sure after I'm done with that, your answers will, your questions will be answered. And if not, then obviously I'm here. I'll open the floor for questions. Okay, so that we can discuss all the questions in one go. Okay, right. Yeah. So obviously the IMGs, they need to go for the IMC exams. Okay, AMC exams and the app registration and all that you need to go with. Okay, so what are the required exams for the for this thing for IMGs? Right. The first is obviously the AMC. AMC conducts the AMC MCQ and the AMC clinical exam. Okay, right. So this two AMC MCQ, we'll talk about it. So AMC MCQ is a 150 questions MCQ based exam. Okay, for someone who's very new to the systems. For that, I'll tell you this thing, right? And the clinical, as the name suggests, it's an OSCE format exam. Okay, for what you have the 16 stations, out of which it is important to pass 9 stations, right? But again, the clinical is a very difficult exam with only 20 to 25% of the pass rate. Same with the MCQ. MCQ has a pass rate of about 40 to the. They've not released the recent data by the APRA, but it's somewhere, it's sitting between 45 to 50%. Okay, I think not less than that, actually, 40 to 45%. Okay, right? So after you've done with both of this thing, then your AMC certificate is issued, okay, which is then makes you eligible for provisional registration. Okay, so that is that. And the APRA and the MBA I already told you about. So which APRA, it looks for the registration. That is a central body for all the health professional, right? And there's also obviously the MBA as well. Okay, which supervises for the supervision levels. Okay, so okay, this is also something that might not be very known to you, right? But when you go to practice as say as like a junior medical officer, a resident medical officer, as a junior doctor, okay, you might be given like level 1 supervision, level 2 supervision, level 3 supervision. So what do you mean by level 1 supervision? Level 1 supervision means that you cannot see the patients on your own. So before you, and okay, so you can just examine the patient, but you cannot go with the management therapy. Like you cannot be the sole decision maker for the management, right? You cannot just directly prescribe the patient. You cannot discharge the patients on your own. So basically, it's one-on-one. Okay, so for every patient, you need to have your supervisor along with you. You cannot see the patients on your own, right? Okay, when it comes to the level 2, so when it comes to the level 2 means that you can see the patients on your own, but still you need to review those patients by your supervisor. And level 3 means you can see it independently. Okay, so who decides that what level you'll be sitting into? Okay, now this aligns with both with GPs as well as for the junior doctor positions, senior doctor positions, everything. When you shift to the Australia, right? So the MBA will decide that what level of supervision you'll be sitting into. Okay, what level of supervision you'll be setting into, right? So that MBA, and that depends on your CV, that depends on your work experience, right? Everything. Okay. So the AMC MCQ part one, as I already discussed, okay, so it is a 150 questions MCQ based exam, which is of 3.5 hours. Okay, we test the clinical knowledge across all the major disciplines. Okay, but it's mostly clinical subjects. Okay, clinical subjects. So it's obviously the medicine, surgery, general medicine, general surgery, obs and gynae, pediatrics. Okay, then also other like the radiology, then orthopedics. Okay, anesthesia. You know, all the clinical subjects. Okay, also some a little bit of the pharmac. Okay, but they don't ask much from the pre and the paraclinical subjects. Okay, not much from that. Only mostly from the clinical subjects. Okay, right. And then we come to the AIMS Clinical Parts 2 exam, which is again a 16 station OSCE-based exam that I just told you, out of which you need to clear 9 stations, right? So this is for the standard pathway. This is what I'm talking about. Again, I'll discuss this under the separate topic, but this is for the standard pathway, right? And obviously, then there is an English proficiency exam. You can take IELTS, 280, PT, doesn't matter. Okay, there's many exams available for that. And there's one other exam which you might not be aware of, which is PESCI, right? So the PESCI is the pre-employment structured clinical interview, right? And that is for the GP position. So after you, okay, it's after you are able to secure a job with a GP clinic, okay, you can take PESCI exam. Okay, you can sit for the PESCI exam. It is again, and it's an online form actually. You might say it's like a mini version of the AMC clinical exam. You can sit for the PESCI, and then, but that is specifically for the GP positions. If you want to work as a GP, then this exam is for you. Okay, so again, in the PESCI, you have 4 cases. Okay, and in the 4 cases, you need to be, you can be, you had at least satisfactory in 3 cases and just borderline in 1 case for you to pass the exam. Okay, for the PESCI. And in the PESCI, there's many other providers, which includes IIME, which is an your Institute for the Medical Education, then RACGP, and ACROM. Okay, so these are the main 3 providers for the PESCI, right? But this is specifically for the GP pathway, so we will not go much in detail about it. Okay. Okay, right. So let's talk about the career pathways. Okay, so what is there in the career pathways, right? Give me a minute. Okay, what is there in the career pathways, right? So the career pathways, obviously, I just told you there's 3: a standard, competent, and the specialist pathway. But the standard pathway is definitely, right, it is your AMC pathway. So AMC pathway, so in which you take AMC MCQ exams, right? So there are some of the eligibility criteria for that, and one is obviously, right, that you must have done your undergrad degree, which we call as MBBS, MD, depending on your country, what it would be, but a primary qualification in the medicine and the surgery, which must be recognized by both AMC as well as the World Directory of the Medical Schools. Right, so you need to run it through them. Okay, so there's a different. So you just type World Directory of the Medical Schools. We're not so sure that whether your med school is included in this or not. Right, so you just go and type World Directory of Medical Schools on Google. Okay, and then you'll know. Okay, and then you'll know that whether I'm eligible for this or not, whether my med school is eligible for this or not. Right, and then you can also go to the AMC website again, and then again in there as well, so you can see that. But mostly, if your med school is recognized by World Directory, it will be recognized by AMC, no problem, right? So then you need to go with the, you need to do the ECFMG verification, all right? So this is the whole process I'm talking about. So it's okay, this also I can cover. So how do you go for the AMC MCQ exam? So it happens in 3 steps. So one is obviously your ECFMG verification. After you get the EPIC verification, then you go and make an AMC portfolio. And yeah, and then you book your exam. It's as simple as that. Okay, that is how it works for the AMC MCQ, right? So that you can go with, and then after that, you can also take clinical. But after taking AMC MCQ exam, and that is also something which lures so many of men doctors into Australia. After AMC MCQ exam, you're eligible for the limited registration, and you can work in Australia, provided if you get get to have a job, okay, in any hospital, right? Or so after AMC MCQ, you can either go with the AMC clinical and then be eligible for the provisional registration and then get a job, okay? And or either you can take PESCI for the GP pathway. So this is basically the standard pathway in its old term, right? So then you apply. So this is exactly what I told you. Apply for the AMC for the standard pathway, the primary source verification. That is nothing but your EPIC verification, right? Then pass the AMC MCQ exam. So after passing AMC MCQ, you have to pathways. Okay, one is obviously to secure an employment offer. Okay, and then apply to the MBA for the limited registration. I just told you, complete 12 months of the supervised practice. 12 months of the supervised practice, or at least 12 months. Okay, and during this period of the 12 months, the best is this. So this is the best pathway, actually, according to me, right? But the main hurdle over there is getting a job. Okay, and just like other countries, even getting a job in Australia as well is also very difficult. It's very, very, very difficult. I got it after like I did a lot of efforts and everything for that. Okay, so that is again a different talk. Okay, and hopefully if we connect again, then I can talk about it. Okay. So this is what I can do it. Okay, so you just get a job, work for a year, and in that duration of 1 year, again, pass the AMC clinical exam, receive the AMC certificate. Okay, and then you'll be eligible for the general registration, right? Apart from the AMC clinical, there's also one more pathway, which is the WBA pathway, which is a workplace-based assessment pathway, right? So whatever hospital you're working in, if that hospital is eligible for the WBA, you can get into the WBA, and then again, then you don't need to take clinical exam. Okay, or after that, it just you feel like that you're not able to get the job, or you're not ready to move to Australia and very soon, then you can go with the AMC clinical. Okay, then get an AMC clinical exam, then secure an employment offer. And after AMC clinical, you are eligible for actually provisional registration. Okay, provisional registration. And then you can just complete 12 months of the supervised practice, and then you can get the general registration. Right? Okay. Right. So see, as I told you, there's three types of registration, which is one is the limited. So IMG, after passing the AMC CAT MCQ exam, you are eligible for the limited registration. Right. So after that, the limited registration, actually, see, limited registration can be of two things. So one for the postgraduate training or the supervised practice, that is what you go into the hospitals to work, right? Or it may be in the area of need. Okay, so area of need is decided again by the MBA, right? So this is just two different types of the limited registration, not something that isn't worry for us. It isn't worry for the MBA. So the MBA will decide that which limited registration to put you into, right? But the main crux is that after MCQ, you can go for the limited registration, and after clinical exam, after passing both clinical exam, in MCQ and the clinical exam, you are eligible for the provisional registration. Okay, you're eligible for the provisional registration, but bear in mind that you can only and only register after you have got a job offer. Okay, by passing the exams, you cannot apply for the registration. You need to have a job offer in hand. Okay, and obviously after that, there is a general registration. So general registration is what? It is MCQ plus clinical plus 47 weeks at least of work experience in the Australian healthcare setup. Okay, so MCQ plus clinical plus 47 weeks of healthcare setup, and that is your general registration. And the general registration is the main aim, the main objective, the whole and soul for any doctor who's working in Australia, IMG doctor who's working in Australia. Okay, all of us wants to get general registration, because after you get general registration, okay, then you can, if you're going to the GP pathway, you can sit your fellowship exams. If you want to do your specialty pathway, then you can start your specialty training, your postgraduate training. But after you secure general registration, so for example, if like for me, like I wanna get into the specialty pathway for the internal medicine, right? So before I get into that pathway, I need to be having general registration, right? So after I have the 47 weeks of the work experience, then I can apply for the general registration, and then I can also apply for the postgraduate training. Right? So the general registration means that's a permanent registration. That is also known as permanent registration in some countries, right? So that is permanent registration. Okay, cool. Right. So now let's come to my fellow dear doctors who's talking about one's from US, one's from Canada, and all these things. Okay. This is the competent authority pathway. What have we discussed till now? That was standard pathway. Another way is the competent authority pathway. This is for, see, first of all, bear in mind, these are the non-specialist or the specialist doctors. Doesn't matter, right? But the approved competent authorities are. So if you pass this exam, okay, LMCC, yeah, is that. Now I get it. I'm sorry. Right? So out of this six pathways, like six competent authorities, which includes what? And one is the GMC. GMC is UK GMC, right? United Kingdom, the General Medical Council registration you're having. That means that, see, what is the authority for that? You must have passed PLAB 1. You must have passed PLAB 2. So both PLABs 1, 2 plus 1 year of NHS experience. 1 year of NHS experience. So if you have this, then you can directly sit for the competent authority pathway. You don't need to take any exams. Okay, you can directly apply for through the competent authority pathway. You can directly apply for the registration if you get a job. Okay. Another is the Medical Council of the Canada. So I think for the exam for that is MCCQE, right? If I'm not wrong, who was talking about the AMC? Yeah, Doctor. Sorry, it's iPhone, right? Right. So MCCQE, plus that you also need a 1 year of experience again in Canada. You need that work experience, then only you can apply for the direct registration. Another is the USMLE. So USMLE step 1, step 2, plus 2 years of work experience in US. 2 years of work experience in US. Mind that it is not just the exams. You also need the work experience, right? Okay, so that's 2 years of the work experience in US. That's for the Emily. Another is the NZREX, which is again obviously New Zealand. Okay, so that's again for the same. If you just taken the exam for the NZREX, then you can directly apply for the jobs because obviously Australia and New Zealand is the sister countries, right? Another is the Medical Council of the Ireland. Okay, right? So if you are registered in Ireland, okay, and you also again 1 year of the work experience over there, you can apply for the competent authority pathway, right? And another one is for the USA, there's an osteopathic board, right? Osteopathic medical examiners, which is very rare. Okay, this 5 is something that you must keep in mind, right? So if you have the qualifications that I'm talking to you about, then you can directly go with the competent authority pathway, right? Again, the same thing is here, right? So the eligibility and this is again, this I've taken the direct screenshots I've taken from the APRA website, so that this is a very authentic information, right? So over there, you can go to the APRA, you can go to the APRA registration, just type that, and this format that I'm talking to you about, requirements for the eligibility for the competent authority path. I've kept it to you for over here, right? See, again, yeah, so this is, oh, I forgot I had this table, sorry, right? So the categories is given to you, right? So for the United Kingdom, okay, so for the UK, right? So you must have passed the PLAB, okay, plus 1 year. So Foundation FI1 must have been completed, right? Must have been completed, right? So again, this is what the same. This was just to 1 year of NHS experience. Okay, for the Canada also, okay, Canada also you must have completed license exam, that is LMCC, right? And 12 months, okay, 1 year that I just mentioned, 1 year of the residency training or any postgraduate education, any work in Canada, okay, right? Right? And then you talk about the USMLE. So you must have passed step 1, step 2, step 3, all the 3 steps, right? And successful completion of the 2 years as a tool, 2 years of the graduate medical education over there. Okay, right? Another for the NZDEX, so successful completion of the New Zealand registration examination and the required rotatory internship, right? So the internship, again, that means 1 year of the internship you must have done with New Zealand. So that is for the New Zealand, okay, right? And what is for the Ireland also you must be, registered in the Ireland and must have done your internship again. So 1 year of internship experience in Ireland you must have done, okay? And that is again for the osteopathic board, so same thing, right? So for the competent authority pathway, now the pathway changes. You just competent authority pathway, no need to take an exam, just secure an employment offer, just get a job, okay? Just apply to AMC for the primary source of verification, then MBA for the provisional registration. You get direct provisional registration if you have passing through the competent authority pathway, right? Okay, and after you have worked for 12 months in Australia, you will get the general registration. You will get the general registration. Okay, right? And then just let me finish the specialist pathway, and then I'll open the floor for questions, right? The specialist pathway is for the doctors in the IMGs who are overseas trained specialists. Okay, that is for the specialist recognition, overseas trained specialist. Okay, right? For the so over here, again, you must have done your primary qualification, MBBS, MD, anything, and also your post graduation. Okay, from an hospital, from the college, which is again registered with the World Directory of the Medical Schools, right? And after if you've done that and if you have sustainable amount of the work experience, right? Then see you can just go and try to apply it for the specialist path. For the specialist path, they have not outlaid proper guidelines. Okay, that like this many years of work experience and everything. It all depends on the where you've done your residency from what country. It matters a lot. Like if you've done from UK or any European country, or even for the New Zealand, it's deeper. It's for the best. Okay, so even if you've worked as a specialist, like for just like a couple of years, still you'll be eligible for the specialist pathway. But for the South Asian countries, okay, I think you need minimum of the 5 to 10 years of the work experience before you can apply for the specialist pathway. And that is the reason why I've seen so many specialists, even though they have done their post graduation, but just because it is very time consuming, okay, they do a lot of check. And after they do the check for about 1 to 2 years, the AMC, they will do this check with the background check and for about 1 to 2 years. They're very slow in this, right? So in that, they think that it's better to go with the standard pathway. Even the specialists are also going to the standard pathways. Even they are taking the AMC exams, but they are like that this is a easier and the better option. Just take an exam and then go into the system, right? So that is for the specialist pathway, right? Okay. Right. So now, if you guys have any questions, please, I'll open the floor. Okay. Whatever questions you asked, then I'll request you to ask them again. If you have any doubts now, okay. If you have any questions now, okay, then please ask the questions. I'll just wait for about 2 to 3 minutes. Dr. Rucha, I've done 1 year compulsory internship after MBBS and 1 year of board completion. Now I'm getting AMC1. Is there any chance for after AMC1 for me to have a job? After which visa I can? There is, but as I just said, you need to wait. Like, so from what I believe, you've done your internship from. So that means you have about 2 years of the work experience, 2 years of the work experience over here. So to believe, right? See, you take AMC1, okay, and then after that, you need to at least wait for a year. You need to very actively apply for the jobs, for the different campaigns and everything. Okay. Now, obviously, there's a chance. Obviously, there's so many people who's working in Australia after just AMC1. So obviously, there's a chance. Okay, but then it all depends on you and your CV and how you are in person. If you get shortlisted for interviews and how you're performing in the interviews, there's so many variables. Okay, no one can be sure about that. But obviously, there is a chance because there are so many people who's working in Australia. Okay, after AMC1. That's obviously you can, yeah. If that answers. What about the job offer, doctor? What about it? You need to secure a job. You need to shortlist for the interview. It's like any other, like there's nothing alien thing which is happening in Australia. It's like any other job that you might have think of. Any other job, right? You just need to apply for the jobs. Whenever those job applications open, just need to go and apply for it. Submit your CV, your resume, your cover letter, your response to the selection criteria if they're having. Submit to it. Okay, and then they'll shortlist you for the interviews if they find you interesting. Okay, and suitable for the role. Okay, then they'll take your interview and then you'll get the job if you just pass through it. So yeah, it works like that. Can we get jobs with just AMC1 exam in 2 years? Yes, you can. Again, Dr. Vidya, yeah, you can. There are people, right? It's me being one, like so. Like even I went to the same path, and you can. Yeah, you definitely can. Can you please elaborate what and how to do postgraduate studies after AMC1? Sorry, WBA. As I just mentioned, that you need to get a general registration, and after you've done your general registration, okay, after that, you need to apply for the programs of the postgraduate training. Okay, so every year, I think they have intakes, at least for internal medicine, they have intakes 2 times a year. So if you have general registration and if you have the permanent residency status in Australia, so these are the two main eligibility criteria. Right? So after you have that, then you can apply for your specialty training pathways. Is MRCPCH acceptable and can we get postgraduate training 1 year on that basis? No. No, Dr. Zil Ehuma. Okay, not even a single Royal College exam is recognized in Australia, except for MRCGP. They have made certain changes for the MRCGP. Okay, so if you've taken MRCGP, they consider it. Okay, but that is not a replacement for the pathway they have. So first of all, see, no, not even MRCP, MRCCPH, no exams are recognized. You can just put it in a CV and it might look good. Okay, and it might look that, okay, you have this eligibility in pediatrics, but it's not going to help you in any manner whatsoever, right? But for the MRCCP, they do consider it, okay, but still you will need to take pesky. Okay, you will need to take pesky even if you have MRCGP. So the Royal College exams are not acceptable in Australia yet. Which part of Australia is better for a job? Any part that you can get into. I found any part that you can get into, yeah. Okay, do you have ideas about my previous query? What previous query? Exemption of AMC2 after US assembly step, but no post graduations. No, no, no. Because what I just told you right now, okay, I don't think you can get exempted from that is that is there only for the PLAB, that is not there for Emily, but it's not there for the step 2. Right? You need work experience in Australia to get into the competent authority pathway, right? So I found no, you cannot get exempted from AMC2 after this. Sorry. Hello, doctor. I finished PLAB 1 and I have 3 years of experience of FY1 equivalent in NHS, but MBBS from Myanmar. Can I go through with competent or the registration? So, may I believe that you also would have passed PLAB 2, right? Right? Because you're working in NHS. So, I don't think you can work in NHS with just passing PLAB 1. Dr. May on, right? So, if my assumption is correct, that you've cleared both PLAB 1 and PLAB 2, and then you have 3 years of work experience in NHS, definitely you can pass, you can apply through competent authority. And good for you, good for you. Actually, who's the main competitions for the people who's there in the standard, who's applying for the standard pathway is the doctors who's coming from UK. So since you're working in UK, you know the conditions of the UK over there, right? Okay, the NHS is really saturated, the pay is not so good. Okay, the workload and everything is really, it's been the worst in the time. So the most of the doctors who's trained in the UK are shifting towards Australia, right? And obviously, because as I just mentioned, UK and Australia, they have very similar system. Okay, so Australia is very, very, very welcoming to the UK doctors, to the doctors who worked or trained in UK. Okay, so they would be preferred the most. Okay, and you can get jobs in like just in 2 months. I've heard that people who just started applying and got a job in like 1 month or 2 months. Okay, if you ever have past PLAB 1 to PLAB 1 and 2, and at least have 1 year of the work experience in UK, right? Do we have to appear for AMC step 1 if we opt for the no? That is the point of competent authority pathway. You do not have to take any AMC exams. Okay, right. Provided you are following, you are in line with all this eligibility criteria that I just mentioned in the table. Okay, you must have passed that exams and must have that work experience depending on upon what country you are from, UK, Canada, US, or New Zealand. Okay, depending on the country and depending on the criteria, you must have followed that. Can I apply to the MRCGP AKT? No, you can't. You can't as of now, because you need to be a GP in Australia. MRC, GP, AKT, and FSP. Okay, this is for the exams for the GPs in Australia, right? So you need to first, well, I'm assuming Dr. Mokrima, right, that you're not practicing as a GP in Australia yet. Yes, right? So you need to practice as a GP in Australia. You need to register as a GP in Australia. After that, because this APSC, GP, AKT, and FSP exam, these are the fellowship exams, dear. These are the fellowship exams. Okay. How can we find vacancy in Australian hospital? Is there any link? Yeah, there are many links, right? But the first was obviously passing the AMC exam, right? So this is what I tell everyone, because even I was in the same state, so I can understand the mental state you were thinking of, right? But first focus on clearing the exams. Okay, that is the only thing that is going to save you. Okay. Right. Yeah, but there are links. So in the Australia, it is also got the federal system. So there are job campaigns, which is different in all the different states. Okay, so there are main six different states. Okay, which includes your Queensland. Queensland is the highest recruiter. So Queensland, then Western Australia, it's also a good recruiter. Then South Australia, Northern Territory, Tasmania, and New South Wales. New South Wales is also a very big recruiter of the MD doctors, and also there is Victoria. Okay, so maybe if you want to know about the vacancies, you can go into the websites of this states. You just type in Google, for example, Queensland RMO jobs, and you will know about the vacancies, Dr. Ruja. Okay, is it impossible to get into the surgical specialty? Nothing is impossible, Dr. Sen. It's just that it's very difficult. It's not impossible. It's okay. But see, in Australia, what the thing is, much like I think in UK and all, UK as well, right? That if you want to get into surgical specialty training, then you need to show good amount of tangible work in surgery. Okay, you need to show that a tangible amount of work experience in surgery. Okay, and that too in Australia, you need to have shown that experience to them in Australia. So you work as a JMO, as an RMO, as a PHO, anything, as a registrar in Australia in surgery. You show them that experience, then you have the general registration, and then you can apply for the surgical specialty. What is the minimum years of experience we need to get for a job? Minimum 2 years. Minimum 2 years postgraduate. I'm talking about, huh? Okay, minimum 2 years, right? And excluding your internship, preferably. At minimum 2 years. How can we get into ENT specialty after postgraduate from India? So you have done your ENT from India, Dr. SRAV Rao. You're already an ENT doctor or what? So you have not finished lab 2 doctor. That is why I just want to find relevant pathway. Then how you're working in, I wonder how you're working. So you're doing internship. So for the internship, you don't need to have cleared the lab 2. Is it so? Then that's a new info for me for UK. After AMC, also I can enroll for the post graduate training in Australia or somewhere pathway. Yeah, yeah, yeah. You can apply for the jobs. As I just mentioned to you, the specialty pathways. It is not easy to get into specialties. Whatever specialty you want to get into, you need to show the work experience in that particular specialty. Okay, then only. And obviously, you need to have a general registration and PR status in Australia before you can get into the postgraduate residency I'm talking about, not job, postgraduate residency in any specialty. What job offer after AMC clinical exam? What first job with over 10 years experience? Okay. You have to start at the RMO or the JMO or as a PHO position after AMC. After AMC clinical exam also it's the same thing, right? Okay, because see, I told you one thing, no, just passing AMC clinical is not enough. Okay, to get general registration, you also need to show 40, at least 47 weeks of work experience in Australia. Okay, are you kidding me? So you, even if you have 10, you might have 10 years of experience, 50 years of experience, whatever, right? You need to at least show 1 year of work experience in Australia before you can apply for the general registration, right? But yeah, after AMC clinical, you can apply for so many jobs. Yeah, if you have 10 years of work experience, again, yeah, so okay, you're just asking for the jobs, Dr. Iphone. So for the jobs, yeah, you can apply for the RMO jobs, JMO jobs, PHO jobs, so many jobs are available. Thank you for answering the question. Is it possible to change from the standard pathway to come to other pathway after that is not something that you can change, Dr. N. I don't understand how you change. So are you saying that you'll you'll take AMC-1, then you'll move to UK, and then you'll take PLAB-1, PLAB-2, work for 1 year in UK, and then you'll come back? What sense does it make? Okay. Either you are a candidate for the standard pathway, either you're a candidate for the competent authority pathway. There is no middle ground. Right? There's no middle ground for that. So yeah, so I don't understand how would that work? Or so you cannot shift. You cannot shift from the standard to the competent. Okay, either you're a candidate for the standard pathway, either you're a candidate for the competent pathway, right? So again, I'm repeating, the standard pathway is the one in which you clear the AMC exams, and for the competent pathway is something that in which for all the eligibility criteria. Again, I'll just put those table for your perusal on the screen, right? So this is the table, right? So if you're following this criteria, then you can go to the towards the competent authority pathway. So you cannot I just don't understand how would that work. Okay, Dr. N, I hope that answers your question. So as per you, after step one, AMC MCQ, we can join job in simultaneous. Yes, yes, yes. And that is what most of the people, that is actually the best part here. See, AMC clinical exam, Dr. Bansal, I'll be very honest with you. Okay. AMC clinical exam is not a very easy exam. Okay. The pass rates for that is about 20%. Okay. And 20 to 25%. And you need to have a tangible amount of work experience in Australia and to know the system as well, obviously, right? You must have to know the system before you can clear that exam. It's not easy. Okay, so that is actually the most preferable pathway you can talk about, right? So because after AMC-1, so if you have worked in Australia, so you would know how the system works, right? And then it will get really better for you to clear AMC-2. Yes, Dr. Bunsen. Yeah, no worries, Dr. Zil Huma. It's very fun to speak your name. I'm already on my retake of AMC-1 again. Okay, Dr. Sharma, it's really frustrating. I was thinking of just specializing in my own country. What are your advice and tips for the retakers? My first take is 249, the second is 238. Okay, so this will be your third attempt. Okay, I did join decoys groups, but still didn't work. Dr. Sharma, this is something that you're not wrong to think it this way. See, I think, okay, what do I tell about this? uh, it's very subjective. Okay, it's very subjective. And see, if you're in your 20s, okay, like in your mid 25s or something, there isn't. I can understand the peer pressure because I'm 25 myself. Okay, and okay, so I understand the peer pressure that we have. Okay, so once you reach 25 years of age or up to that and cross that, obviously, the peer pressure is real. Okay, so I think this is something that you need to ask yourself. Okay, that whether what you're going whether this is worth it or not. Okay. Do you want to do this specialty? Because even after doing your specialization in your own country, okay, and from the name, I'm guessing you're from India. So even after you're doing your specialization from India, obviously this pathway is already open, right? This pathway is going to be open at all point of times. So if you think that you're being left out and this is taking a lot of space in your mental energy, in your physical energy, in your financial energy, this is taking a lot of space in that, then yeah, you can think about doing PG in India. Okay, and then you can consider about that maybe. Okay, or maybe you can just I just want you to consider all your options before you make a decision. Okay, and I wouldn't mind getting in touch, you getting in touch with me or with any of our mentors. Okay, everyone's would be really happy to assist you. Yeah. Yes, only job. Okay, we will get a limited registration after AMC 1, or we have to secure a job and then we will get limited. Yes, yes, yes. For any registration, keep it in mind, you cannot get any registration before you have a job. Okay, that applies to a limited, to provisional, to you cannot even apply for the registration because the first thing that you need to upload is the offer letter. Okay, you are that is why I say there's a difference. So after passing AMC 1, you are eligible for limited registration. Okay, so once you get a job, then you can get the limited registration. Dr. Bansal, what additional requirements do we need in CV other than AMC, MCQ, and 2 years of experience? Do research, do clinical audits. Okay, that would help you. Do research, do some other supplementary programs. Okay, like say for example, you want to, it's like I want to work in medicine, so I do CPCDM, which is a program for the diabetes management. Do something like that. But I think for the Australia, it's enough. Okay, just passing the exams and having a good amount of work experience, that is enough. Is emergency medicine specialty acknowledged in Australia or still have to take up standard pathway? Can we apply for presumption? That depends on where you've done your emergency medicine from. You've done your PG in emergency medicine, Dr. Sharma? Okay. And if it is from the countries that I mentioned over here, then only it is recognized. Other than that, it will just be work experience, nothing else than that. Can we apply for observership even without AMC 1? But there's no point of it. There's no point of it without AMC 1. And that's also, I to be very frank, that would also be a waste of your money, right? And again, for another thing, the observerships are not that important in Australia as it is in US. Right? So in the US, the observerships, electives, they take a lot of importance for that. But in the Australia, it doesn't matter, right? But that is something that you just want to, for example, see what people usually do is that they book their AMC clinical exam. And anyways, for the clinical exam, they need to move to Australia now, right? Because it is a face-to-face exam now. So what they'll do is like because anyways they'll be going for 3 to 4 months, right? So they'll take their AMC clinical exam in just 1 month, and then for the rest of 2 to 3 months, they'll find some hospital for observership, and then they'll do it. So that is the most sensible way of doing an observership. But there is no point of going specifically to Australia just for observership. To my mind, that is just waste of your money, your time, your energy, everything. It doesn't matter, right? Because observership is not of that they don't even it doesn't matter because this is what they clearly mentioned in the APRA that the observerships is not considered as a work experience. So instead, I'll recommend you to not have any clinical gaps. See, clinical gaps are really frowned upon in Australia. In anywhere else you go, but in Australia especially, like if it is more than 3 months, you will need to put a really good explanation for that. And why is there a gap for 3 months? Well, and that can also cost you. That can also cost you a job, right? So the reason why I got successful in this is because I have no clinical gap since I graduated, not even for 1 month. So after I graduated in 2023, I graduated my MBBS in 2023, right? And just in just 2 months, after 2 months, I got into the jobs. Okay, I worked as an Western medical officer. Then I worked as currently I'm working as a general resident doctor, right? But there is no gap in my resume at all. Okay, so it is better to have the continuity in your career than to go for the observership and just waste your money. Peer pressure after 25. Yeah, I know. Yes, yeah, for too much, too much. This year I turned 25 and I feel like, oh my God, I'm any age limit for getting job after passing AMC both parts? I don't think so. I'm not so very sure about it, Dr. Ifan. I'm sorry. Um, uh, I think I think it's about there's no age limit for the jobs, I think, but for the visa there certainly is. Okay, so I think and that is I think 60 years or something, 60 years or something, yeah. But I'd recommend you to cross check. Okay, I'm not so very aware about it because I've not made many research on this. I'm sorry. Is there any age limit for AMC 1 exam, Dr. Shehzadi? I don't think so. Okay, I'm not so sure about the age limit. I'm so sorry. I'm terribly sorry, guys. That is not something that I've made a lot of research about, but I can, and I think I can find proper guidance about it, and then I'll forward it to Mr. Fazan, okay, who's the coordinator for our today's discussion, and maybe he can share it with you guys. Okay, that works. Dr. Vihita. I'm 48 months DA plus DNB trained anesthesia person from India. Okay, have 12 months of experience. Can I apply for ends? No, no, no. To get partial compatibility, you can't. You can't. So then, Dr. Reddy, I'm afraid it doesn't work like that. Okay, so this is so you're talking about in the specialty pathway, not even competent. This is specialty pathway. ANSCA is the registration body for the anesthesia, and it doesn't work like that. Okay, 48 months is 3 years of work experience, right? Okay, so that is 3 months of the training, no? And that is the 3 months is the part of your training. Okay, I'm talking about that you must at least have 5 to 10 years of work experience after your postgraduate training. Okay, for you to be eligible for the specialty pathway. Okay, specialist pathway. So I think this 3 months that 48 months you're talking about, the 3 years that you're talking about are your PG years, right? So no, I don't, you're not eligible for that. You cannot apply directly for ANSCA. And anyways, for applying to this registration bodies, be it ANSCA, be it RSCGP, be it all this for the RENZOG, which is for obs and gynae, all these things. Okay, you must have general registration. Okay, and to have general registration, now you know what to do. Dr. Bidya, if I apply in one place after AMC MCQ and later shift to another place after AMC2, will that yeah, of course you can move, I think, but this is something that that you need to you're being too early to worry about this. Yeah, obviously you can shift places, there's no problem about that. Yeah, no worries, Dr. Reddy. After AMC1, through WBA we can get license any other way, like we work in Australia for 2 years and can the employer assess us and help us. But that is what I said. No, not all the hospitals are eligible for WBA. Not all the hospitals can do workplace based assessment, right? Not all hospitals do. So it depends that after AMC1, the job that you're getting into, that hospital, is it providing you WBA? If it is, then good. Those who have already verified degree for USMD Step 1 by ASIM, do we need to verify it again? No, no, I don't think so. That means you already have EPIC certificate, right? You already have EPIC verification, then you know to do that. You can just directly go to AMC portfolio, right? But yeah. One thing, but for the ECFMG, because for the ECFMG, so they ask you that to what body would they want you to, send their EPIC forms. Okay. So for if you've taken USMLE, then I think you only would have sent it to the USMLE authority pathway, whatever it is. So now you also need to add AMC. You also need to add Australian Medical Council in your ACFMG website. Okay. So you would want your EPIC form, you would want ECFMG to submit it to AMC. Right, so that is a change that you will need to make, Dr. Shehzadi. How long do we have to wait to do AMC2 after AMC? You can take it right away. It depends on you. Okay, you can take it right. There's no such time gap that must be there between AMC1 and AMC2. Nothing like that. Okay, okay, really good. Okay, so this are okay. I think I'll be a little swift now. Okay. Okay, I think this was the most important part. So for okay, so these are the different positions that you can get. You can intern, RMO, registrar. Registrar is in a different specialty. Okay, and which MCQ bank you can see, either you can join this academy. Obviously, there's also M plus X, there is MEDEX, all these MCQ banks. There's also eMedici, which is recently introduced by AMC. That is also a good question bank, Dr. Hansal. Right? So GP, these are all the different positions. These are all the salary expectations that you can get into, right? That is, I have put it over you for use that you can see it over here, right? And obviously, influence factors where you're working. That is also very important. I have completed MRX. Do I need to work on this? There's no harm in doing so, right? Obviously, there's no harm in doing so. Go for it, right? Career progression pathways, right? So I already talked to you about the GP pathway, specialty pathway, right? You can also go for the career medical officer, but again, you need general administration for that. You can go with the public health and research. So this is something that we already discussed in brief. So this I actually wanted to discuss, but even already you guys asked me a lot of questions on this, and I've already explained. Okay, how does the GP pathway work, right? So see, you need to see training duration. So this is how we do. So for the GP, for the someone who was asking to me about for MRC GP or something regarding GP, someone was asking to me. So for the GP, you need to take AMC1, take PESCI, okay, work as a GP clinic for 3 to 4 years, then take, okay, yeah, someone was asking about AKT, no, for RSCGP AKT exam. After 3 to 4 years, then you sit for your AKT FSP exams. Okay, and then you get FRACGP. FRACGP after that. Okay, so this is the part for the GP. Okay, I hope that makes sense to you. Okay, right. And see, this is the specialty training pathway. So this is how long the training pathway is going to be after you get general registration, and then you get into the specialty training pathways. Okay, right. Usually start PG 3 by 3 plus, so post RMO. So after you worked as an RMO, then you can get into these things. Okay, so these are the main things. So RACP is for the internal medicine pediatrics, RACS is for the surgery, RANZOG is for the obs and gynae, FSCM or ACM is for the emergency medicine, RANSP is for the psychiatry. Okay, right. Alternate career pathways is you can get in administration, public health, medical education, right? But you need to have done specific degrees for that, right? So pathways to the PR and immigration, right? So what do you need to do? Just know about this thing is this immigration overview, right? So what you can, so after this is something that you need to know that after you've gained a job. So Australia welcomes a skilled healthcare professional. So you can work into skilled healthcare pathway is there, specific is there, right? So skilled occupation list. So the medical roles are on the skilled occupation list. Okay. So once you move over there and you get a job, okay, then you can either get a temporary visa or you can also then progress. So like even after you get a job offer, you can just directly apply for the PR because that also takes 1 to 2 years. So just apply for the PR, it's a permanent residency over there, right? Right? And these are the different visas. So main visa is the 482 TSS, temporary shortage, skill shortage visa, TSS, right? Rest which is employer sponsored, that will give it to you about 4 years. So most of them they go with the 482 visa, right? Right. Okay. So means these are other visa departments that you can talk into. Right, so the earning PR. So how you can get a PR? So obviously get APRA registered, be it limited registration, just get an employer, just start working over there, pass required exams. So obviously, if you have a job over there, you have to pass the required exam. So once you have a job over there, even after limited registration, you can start applying for your PR. You can get PR. So PR you can get it. See, that's a good point for Australia. You can get PR in about 2 years. You don't have to wait for about 10 to 15 years, just like you have to in US. Okay, right? And there's one more thing that if you're working as a GP, then one term that you must need to aware of, that is a distribution priority area, right? So let's see, there is actually modified Monash model. This is just for GP, huh? This is just for GP, not for the people who want to work in Australia. Right? This is a modified Monash model. They've classified into 1 to 7. So the 7 means as you descend down, so in the descending order, that means that the area is in more of need. So more you go towards 7, the more the rural and the regional the area gets. Okay, and more is the need for the doctors, right? So this training, no, I just told you that after PEST you need to work for at least 3 to 4 years, and then you can apply for the fellowship exams. So see this, how many years you need to work as a GP? Okay, that is also decided by MBM and APRA. Okay, and that is decided on the basis of in which area you are working. So for example, if you're working in an MM5 area, then it'll say that okay, you just need to work as a 2 to 3 years as a GP over here, then you can sit for the fellowship pathways. But if you're working in the MM1 or MM2 area, then you need to work for 7 to 8 years, maybe 5 to 7 years, right? So this is something, but this is something that if you are just working as a want to work as a GP, what kind of visa do we need to apply for after passing AMC1? um that depends, no? Like if you're going for just for aims, say for example, you're going for observership or the clinical exam, then just go with the your tourist visa. If you're getting a job, then you can go to 482A visa, temporary skill shortage visa, right? Yeah, that's what I said. 482, because that is not something that's going to apply for. Other visas I'm not so aware about. So you can take a screenshot if you want to before this table, right? These are the main visas. But main is 482A visa. Main is 482A visa. Okay. Yeah, so that was all about it. These are all our upcoming courses. Me, along with Dr. Nbira, Dr. Kiran, and Dr. Farhat, are more than happy to welcome you to our team, right? Okay, we have the regular courses, we have the crash courses. Okay, regular courses start in which we target for the exams in the November. Then we call a crash course. Crash course will be there in the October. Next, if you're targeted to take your exam in the November, you can join our regular course, right? And all of us, I think we have been teaching for the AMC for like so many years now. I think Dr. Nbira, who's also I think a senior mentor who's also involved in teaching for like about 2 to 3 years or what. Me myself, I'm like at the end of my second year of me teaching for AMC, right? So this is for the regular course, for the recall crash course. In the regular course, you will have everything. You will have live session with us on all the different subjects that you need to be aware of. And you will also get a recorded session for that as well. Obviously, you have one psychiatry workshop over there, right? Recalls, you get a lot of recalls. Okay, you will not need to go to other PU banks and find for the recalls. You will have a lot of recalls, solved recalls, PDFs would be directly be given to you. in the regular course. There'll be question bank questions, 5,000 plus per AMC question bank questions. So question bank, most of the major question banks, those questions are included over here. Okay, there's 3 full-length mock exams over here. Okay, we take quizzes, we take notes and everything, right? And obviously the PDF is provided to you for all the sessions. So for all the live lectures we are taking, the PDF will be provided to you. There's minimos, there's flashcards, so many things for you to ensure that you are on your right, correct pathway to get prepared for the exam. And same thing for the recall crash course. So in that, there's just 18 live sessions. Okay, usually we have 42 interactive live sessions, but the recall crash course, there's just 18 live, very crisp sessions, right? And along with that, we'll also be giving you the notes and everything. Again, you will have Q banks, mocks, and everything. You have access to all of those things. Just only difference is that you will have lesser amount of sessions. But other than that, you will have everything. Okay. And this is our team. Okay, as I just already mentioned to you, right? This is our team. This team of us 5 people, and we'd be really happy to welcome you over here, right? Okay. So thank you so much, everyone. Again, I'm opening the floor for the questions. This was, I think, a really fun webinar. Okay, if you have any other questions, please feel free to ask. Please feel free to ask. I'm here to answer your questions again. How much is the fee? Oh my God. Um, Wait a minute. What was the exact? I think they have changed it. They've changed it, Dr. Sharma. You'll be okay. Fees for the courses. Please get in touch with his contact numbers, which is going to you. I think Mr. Jafar from our team has been sending you the message. Okay, so you can just WhatsApp on this number. Just WhatsApp on this number, which is provided over there. Okay. Oh, it was my pleasure, Dr. Ong. It was my absolute pleasure. Okay. Uh, yeah. So he's saying drop your number over here and then share the. So whosoever wants to know about the course details, just drop your number in the chat section and our team will get in touch with you. Thank you so much, Dr. Risha. Thank you so much, Dr. Bansal. Okay, I'm waiting here for the 5 to 10 minutes. If you have any other questions, please feel free to chat. Yeah. Anyone else? My pleasure, Dr. Shehzadi. Only recall of same month where we can join? Yes, I think so. Yeah, yeah, yeah. Like my exam is in September. Yes, 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 yes. We do provide such recall sessions. Yes. Just drop your number in the chat section and you will get the details for that. My pleasure, Samsung. Was my pleasure. Will message number? Yeah, perfect, Dr. Sharma. Just to be perfect name there. Thank you for sharing the number with your contact on WhatsApp. Oh, okay. Is November a fair good month for retake? Doctor, that is what they say. And not for the Feb. I think, see, first of all, let me tell you one thing. There is so many, your myths which is associated with this exam. Feb, they say that it's, I think, a difficult month to take. That is what they say. I took it in June. For the June also, they say the same thing. But for the June also, they say the same thing. The June is also a very difficult month to take, and there is also very less pass rates. Even though it was a very difficult exam, I can agree with that. But yeah, I think you can go with November. You can go with November. Yeah, no problem with that. You can just go with November if you decide to take AMC. Yeah, amazing. Yeah, yeah, yeah. Dr. Sharma, thank you so much. Thank you so much for your kind feedbacks, everyone. I'm really happy that I could be of help to you guys. Anything else that comes to your mind, just feel free to talk. Okay, because this is something new. Not much is talked about in Australia now. Okay, now there's a different thing that now so many people have started to make so much videos on YouTube and all the spaces. So, but when I started with the AMC, very little was known about this pathway and about this exam. Okay, and I wished I had someone, I had such webinars taking place, right? But I didn't, right? I had to figure out everything by myself. Okay, but it's good that you guys have had guidance, a lot of guidance, ample amount of guidance that you guys want to. Okay, and just take advantage for that. Okay, then this should be wind it up. Any place where we can make resume as per Australia. You see, as per Australia, there's nothing. So I think what you can do is you can just go to the Queensland website, and the Queensland has given you a CV template. Okay, so you can make a template according to that. Okay. See, this is also something that we are planning, so I can help you. So after you guys pass your exams, I'm always here, happy to help you for the job assistance. Don't worry about that. Okay, I'll personally help you to cater your CVs. Okay, so don't worry about that. Okay, at all. Okay, but as of now, just focus on clearing your exams. Okay, clearing your exams should be your only goal right now. Okay, anything else? Anything else, Dr. Bansal or any other doctor? Okay, then. So with no other questions in our hand. But I think we discussed a good amount of questions. I'm really happy that you guys were so active. Okay, I really, really appreciate that you guys are really active in this session. And that is actually what made it so productive, right? Because this was, in general, it was a very boring session, right? Just talking about like, what is this? What is the pathway? What is this and that? But your questions made it interesting. Okay, and your questions also made it to cover so many different topics because I might not have everything in my mind. Okay, but just because you asked a lot of questions, so I could, deliver everything, most of the things that is there to know. We'll be waiting for WhatsApp about fees and other details. Oh, yeah, yeah, yeah. Sure, sure, sure. Sure. Okay, and I'll be waiting to have you in one of my lectures, Dr. Bansal. Okay. Okay then. So with that in mind, we will we will wind it up. Thank you so much, everyone, for joining. Have a great day ahead. Okay, and as I say to everyone, keep studying, keep flourishing. I wish you guys all the very best. Okay, and great things lie ahead. Just believe me, just trust me when I say this. Great things lie ahead. Just keep believing, keep hoping. Okay, and uh, 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 it will work wonders for you. Okay, definitely it would work wonders for you. Okay, so with that, if someone is here to who wants to have any uh, word with our team. So I'll just keep the session on for a while, right? Yeah.